Okay, so risk, right?
Mm-hmm.
A lot of lines on there.
Yes.
So what can we do to lower the risk?
So, of course, smoking cessation. That's why I said tobacco use, of course. Now, tobacco can increase the risk of literally every type of cancer: lung cancer, skin cancer, colon cancer, breast cancer, mouth cancer. We could keep going. Increases the risk of all. So really stopping tobacco use is hugely important at decreasing the risk, as well as limiting alcohol consumption. So they say, the breast surgery world, less than 3 alcoholic beverages a week. Now the cardiologists say 4 ounces of red wine a day. So I like to say all things in moderation, and I leave all the rest up to you to make the best judgments for yourself. But technically 3 or less a week. Also limiting the amount of red meat and dairy. So this is something called a Mediterranean diet. So lots of fruits, veggies, lean fish, chicken, grain. Minimizing how much red meat and dairy we take in to our diet will help to decrease the risk. And then a healthy body weight is important, as well as exercise. I love this part of my talk because exercise is so important for everything. It's good for your heart, it's good for your lungs, it's good for your mental wellness. But with breast cancer, it can decrease the risk significantly. So 150 minutes a week, or broken down into 30 minutes of exercise 5 times a week, can decrease the risk of breast cancer and breast cancer recurrence by 40 to 50%. Huge. That 30 minutes a day can actually change your risk for breast cancer. Now, I'm not saying walk your slow puppy around the neighborhood, because my dad had a puppy who just lied in the road and had to be picked up and brought home. That's not the kind of exercise we're talking about. It is moderate exercise, getting the heart rate up over 120, 130 to start breathing a little heavy. That is where it hits. Also, this will be my plug for all things bone health. As we get older, bone density, it's a concern. And weightlifting can help that. And women who are actively under treatment for breast cancer, who are taking those the anti-hormone pills that block the receptors, their bone density can be affected. But weight-bearing exercises will change that. We put strain on the bone, it causes the bone density to increase, which is hugely important. You do not have to be a bodybuilder, but if you want to go compete, I will be in the first row. That being said, lift some weights, get your body moving, and help to decrease your risk of breast cancer.
Yeah, as a wellness person, this slide is my jam. But I think we tend to overcomplicate wellness sometimes, right?
Sure.
And generally, we just need to think about whole foods, like eating whole foods, things with lots of colors, right? Healthy fats, lean protein, and then just moving your body.
Absolutely.
And so I get a lot of people who, say that they don't have time for exercise. Anyone relate to that, right? Is 5 minutes greater than 0 minutes? Yes. And so we want to start just getting that in there. And then the weight-bearing exercise is really, really important for really everything as we age. So just back to the basics. Keep it simple and just focus on whole foods, nutrition, and moving your body.
And one time a week is better than no times a week.
Right.
Always.
Right.